According to DSM-5, the minimum duration of symptoms required for diagnosing schizophrenia is 6 months, including prodrome and residual. First-rank symptoms of schizophrenia were described by which psychiatrist? Kurt Schneider. A 22-year-old presents with acute fear, palpitations, chest tightness, and a sense of impending doom, peaking within 10 minutes. Best immediate drug: sublingual alprazolam 0.5 mg, benzodiazepine for panic attack. SSRIs are first-line maintenance for panic disorder. Recommended minimum duration after remission, months? 12. Hamilton Rating Scale is routinely used to quantify severity of which disorder? Major depressive disorder. Patient on lithium develops coarse tremor, ataxia, nausea, serum lithium 2.2 milliequals per liter. Preferred management: hemodialysis, severe toxicity greater than 2.0. Drug of choice for rapid cycling bipolar disorder besides lithium? Valproate. Which atypical antipsychotic carries highest risk of metabolic syndrome? Olanzapine. Neuroleptic malignant syndrome, first-line pharmacologic antidote, dantrolene. Cage questionnaire screens for use disorder, alcohol. Wernicke encephalopathy triad, confusion, ataxia, and ophthalmoplegia. Drug used to maintain abstinence in alcohol dependence by inhibiting aldehyde dehydrogenase, disulfiram. An 18-month child lacks eye contact and fails to respond to name. Term for this early social deficit? Autism spectrum disorder. Methylphenidate improves core symptoms of NX in school-age children, ADHD, attention deficit hyperactivity disorder. Confabulation is classically seen in which chronic amnestic syndrome? Korsakoff psychosis. Delirium versus dementia, which has fluctuating course with lucid intervals? Delirium. Mini mental state examination perfect score? 30. Donepezil and rivastigmine act by inhibiting which enzyme? Acetylcholinesterase. Postpartum blues typically resolve within 14 days without treatment. 14. Postpartum psychosis risk is highest in mothers with history of which mood disorder? Bipolar disorder. Anaclitic hospitalism depression occurs in infants after separation from primary caregiver, mother. Term for pathological jealousy delusion often focused on infidelity of partner. Othello syndrome. Ego-dystonic, unwanted intrusive thoughts in OCD are called obsessions. First-line pharmacologic treatment for OCD besides CBT. High-dose SSRI, e.g. fluoxetine 40 to 60 mg. Exposure and response prevention is a form of which therapy paradigm? Behavior therapy. Which personality disorder is characterized by excessive emotionality and attention-seeking? Histrionic personality disorder. Dialectical behavior therapy, DBT, is evidence-based for which personality disorder? Borderline personality disorder. REM sleep latency is equal to shortened, prolonged in major depression, shortened. Zolpidem acts selectively on which benzodiazepine receptor subtype? Omega-1, BZ1, subtype of GABA-A receptor. If taken before a great narcolepsy pathogenesis involves deficiency of which hypothalamic neuropeptide? Restless leg syndrome typically worsens during which period of day? Evening, night. Acamprosate maintains alcohol abstinence by modulating which neurotransmitter? Glutamate, NMDA, and GABA balance. Buprenorphine-naloxone combination ratio, milligrams commonly used for opioid substitution in India. 2 mg buprenorphine times 0.5 mg naloxone, 4:1. Flashbacks after trauma are criterion B in DSM-5 diagnosis of post-traumatic stress disorder. Eye movement desensitization and reprocessing, EMDR, is specifically designed for which disorder? PTSD. Beck's cognitive triad of depression includes negative views about self, world, and future. Bright light therapy is most effective for which type of depressive episode? Seasonal affective disorder. Electroconvulsive therapy, minimum recommended seizure duration, seconds for therapeutic adequacy, 25. Absolute contraindication to ECT, no absolute. Relative include raised ICP, recent MI. First-line drug for generalized anxiety disorder per NICE guidelines, sertraline, SSRI. Buspirone acts as partial agonist at which serotonin receptor? 5-HT1A. Atomoxetine is a selective inhibitor of reuptake of which neurotransmitter? Noradrenaline, norepinephrine. Cheeking or storing medication for later overdose is called cheeking, palming, termed cheeking. Young man with delusion of doubles believes relatives replaced by imposters, syndrome, Capgras delusion. A prosody rate of 120%, loss of previously acquired motor and social skills after 2 years normal development in girl, hand-wringing stereotypy, gene, break time 400 milliseconds. MEC2 mutation, Rett syndrome. Prosody. ECT electrode placement unilateral over non-dominant hemisphere is called right unilateral electrode placement. Mirtazapine causes weight gain due to antagonism at which receptor? Histamine, H1. Discontinuation syndrome is worst with which SSRI having shortest half-life? Paroxetine. Clozapine mandatory ANC monitoring interval after first 6 months, every 4 weeks. Akathisia is best managed initially with which class of drugs? Propranolol, beta blocker. Tardive dyskinesia pathogenesis involves supersensitivity of which dopamine receptor? D2. Varenicline aids smoking cessation by partial agonism at receptor alpha-4, beta-2, nicotinic acetylcholine receptor. Levinson technique refers to which psychotherapy model? Supportive psychotherapy for schizophrenia. Speak. Clock drawing test. Clock drawing test. Frontotemporal dementia variant presenting with progressive non-fluent aphasia involves degeneration of which lobe? Left inferior frontal Broca region. Aversive conditioning using emetics was historically applied to which dependence? Alcohol dependence. Child refusal to speak in social situations but normal at home? Disorder? Selective mutism. IQ of 50 to 70 corresponds to which category of intellectual disability? Mild. Primary nocturnal enuresis, first pharmacologic choice when alarm fails? Desmopressin nasal oral. Trihexyphenidyl alleviates Parkinsonian side effects mediated by imbalance between dopamine and acetylcholine. Most common side effect of ECT besides transient memory loss, headache. Sodium valproate is contraindicated in women of childbearing age due to risk of fetal what? Neural tube defects, spina bifida. ECT stimulus dose is titrated according to patient's age or seizure threshold. Age times 0.5 as rule of thumb. Psychological technique of converting maladaptive thought into logical adaptive one is cognitive restructuring. Obsessive-compulsive personality disorder differs from OCD by absence of true obsessions, compulsions, and is ego-syntonic. Involuntary jerky movements exacerbated by stress after long-term antipsychotic use is tardive dyskinesia. Atypical antipsychotic with highest prolactin elevation, risperidone. Fluvoxamine strongly inhibits CYP1A2 and increases levels of which xanthine derivative? Theophylline. Naltrexone for alcohol dependence, dose milligrams per day, 50 milligrams daily. Cognitive triad concept was proposed by which psychiatrist? Aaron T. Beck. First-line pharmacotherapy for social anxiety disorder, SSRIs, e.g. paroxetine, sertraline. Porosity rate 120%. Hyperprolactinemia-induced amenorrhea by antipsychotics treated with switching to aripiprazole, aripiprazole, partial agonist. Child behaves older than age, seductive with adults, multiple foster placements, disorder, disinhibited social engagement disorder. Y-BOX is clinician-rated scale for severity of obsessive-compulsive disorder. Serotonin syndrome triad, autonomic instability, mental status changes, and JUT, neuromuscular hyperactivity, clonus, hyperreflexia. Most effective long-term treatment for refractory OCD, surgical, anterior capsulotomy, deep brain stimulation. Pharmacological agent for PTSD nightmares, prazosin. Kluver-Bucy syndrome arises from bilateral lesion of what? Amygdala, medial temporal lobe. Ganser syndrome, characterized by approximate answers, is a subtype of something disorder. Dissociative. MSc term for fabricated but believed memories filling gaps, confabulation. Sertraline preferred SSRI in cardiac patients because of lowest risk, QTc prolongation. Abrupt cessation of short-acting BZD leads to withdrawal seizures within 24 to 48 hours. Tobacco withdrawal most intense craving occurs at which day post-quit? Day 3. Pathological gambling is categorized under DSM-5, Section 1. Substance-related and addictive disorders, non-substance. Which hypnotic is safe for insomnia in elderly due to minimal hangover? Zolpidem, 5 milligrams. Schizophrenia prognosis is better with onset and presence of depressive symptoms, acute versus insidious. Clozapine agranulocytosis defined as ANC greater than, less than 500 microliter. Inducer of CYP3A4 among antidepressants? None. Most are inhibitors. Mirtazapine, minimal effect. Impulse to pull out one's own hair, leading to alopecia, is called trichotillomania. Algorithm-based suicide risk scale used in primary care, India. Sad person scale. ECT-induced seizures are monitored by simultaneous recording of which peripheral reflex? Cuff-inflated limb for motor seizure, tourniquet method. First antipsychotic with proven mortality benefit in treatment-resistant schizophrenia, clozapine. ECG change requiring urgent cessation of antipsychotic, QTc equals 500. Agoraphobia must involve fear of at least something. Situations as per DSM-5. 2 or more, e.g., public transport, open spaces. Munchausen syndrome by proxy is classified under special disorders. Factitious disorder imposed on another. Reversible MAOI used for depression in India, moclobamide. Elevated serum GGT and AST-ALT ratio greater than 2 suggest chronic use of which substance? Alcohol. Premenstrual dysphoric disorder treatment approved SSRI taken only luteal phase. Fluoxetine 20 milligrams per day. Deep brain stimulation target nucleus for severe OCD, anterior limb of internal capsule nucleus accumbens. Double depression refers to major depressive episodes superimposed on chronic disorder, persistent depressive disorder, dysthymia.